Hi, my name is Melissa Vesperman. I'm the Executive Director and the Manager of the Nurses at St. Croix Valley Sexual Assault Response Team. I'm also one of the on-call nurses. So if you do come for an exam, you might get me as one of your nurses that responds. I have been a nurse for almost 20 years, and I have been a forensic nurse for almost 13 years. Really pride ourselves in the opportunity to offer patients a choice in their location for where they want their medical forensic exam or sexual assault exam. There are benefits to both an emergency room location and the community-based site location. Um, if somebody is worried about privacy, if they're worried about having to tell too many people or being seen at an emergency room, the community-based site can be a great option for that because it is very private, it is very quiet, calming, um, and there's not as many people that you would have to encounter when you come to community-based site for the exam location. The emergency room is a great choice when you are worried about pain, if you're worried about injuries that may need treatment, maybe stitching or being addressed by a medical provider other than a SANE nurse. Also, we would encourage people who have been strangled to be seen in the emergency room. We can see you in the community-based site, but based on our assessment, there might be circumstances when we would really encourage you to go to the emergency room for further assessment, maybe imaging, maybe a second opinion by a medical provider, such as an ER physician or nurse practitioner. The last reason we may encourage you to be seen in an emergency room versus a community-based site is if you're worried about security at all. If somebody that is your perpetrator knows that you're going for a forensic exam and knows the location of the community-based site, you might be more secure in an emergency room where there is security on staff.